This was all over the news yesterday, and this story is absolutely wild. Surgeon Thomas Sheknovsky was charged with manslaughter following the death of a patient. Some of you may remember when this story was first reported on last year, and I'll be honest, I didn't believe it, because this is not something I would have ever guessed could actually happen. A patient by the name of William Bryan was visiting in Florida, and he had left-sided abdominal pain and went into the emergency room. After admission in the emergency room, he was found to have an enlarged spleen, and his blood count was going down, and the concern was that he was bleeding from this enlarged spleen. Now, it is noted that the imaging that was done of Mr. Bryan's abdomen showed the enlarged spleen, but did not show any blood or fluid in the abdomen, which is what you would expect if you had a large drop in your hematocrit that supposedly was seen. So the patient was spoken to by the surgeon, Dr. Thomas Sheknovsky, and he recommended that the patient undergo a laparoscopic splenectomy. The patient did not want to do this. He wanted to leave and go back home to his home physician's hospital that he was comfortable with. But apparently he felt a bit bullied by this surgeon and ended up going to the operating room. In the operating room, the patient ended up having his entire liver inadvertently removed, not the spleen. So the surgeon started with a laparoscopic splenectomy as planned and was unable to see. Apparently the colon or some of the bowel was very distended and enlarged, and that made it so he just couldn't see what he was doing. So he opened the abdomen, and in the process of what he thought was dissecting the splenic vessels, things started to bleed. So he continued to just cut stuff out, it sounds like, to stop the bleeding, and ended up removing the entire liver. So when this first got reported on, I was like, there's no way this can happen. I mean, a medical student knows the difference between the spleen and the liver, the blood vessels, how it is attached in the abdomen. This is not something a boarded surgeon could possibly do. I am flabbergasted that this actually happened, but it actually happened. So if you've ever rotated on liver transplant, you've seen a liver removed, because in the process of a liver transplant, they remove the old liver and put a new liver in the exact same spot. This is called an orthotopic liver transplant. It's hard to remove the liver. It's not something you can quickly do in a couple seconds. The fact that he somehow did this is insane. This is beyond a normal surgical complication. This is beyond even normal incompetence. This is criminal, and he is now being charged. Even at the time, they were reporting that he had a prior malpractice lawsuit where part of the pancreas was removed instead of the adrenal gland. That's actually a known potential complication, especially of a left adrenalectomy. So those of us that are trained as surgeons were like, okay, let's pump the brakes. This sounds like plaintiff lawyer stuff. But it wasn't. This really happened. And I don't understand how someone like this was able to get through training and practice at all. So there's now several cases like this that are going through the legal system around the United States where physicians are being charged with actual crimes for negligent care. And it'll be fascinating to see how this plays out.